Dear friends, we are discussing obesity as an epidemic unraveling. Now, I will suffice to mention that today obesity has become the most important contemporary challenge, both in males and the females, and also in the children. Therefore, it is an epidemic which is really unraveling and posing huge problem. This program is sponsored by Eli Lilly, and speakers, including me, are presenting it on behalf of the Eli Lilly and Company. And during the meeting, you are requested not to take any photograph and not to ask for any questions which is off level. That we can discuss, but will not ask it here, and not to take any photographs or videos. Now, I'm a speaker for Eli Lilly today, and I have also spoken for other pharma companies, and this session is sponsored by Eli Lilly. Now, I would like to start by saying that obesity is not a result of the lifestyle aberrations, not because of lifestyle wrong choices. Three things we must remember. Obesity is a chronic disease, it's a progressive disease, and the accumulation of body fat poses risks to health. It was told about few years back that obesity produces 218 diseases. Today we know that obesity can produce 292 diseases at least. Dear friends, if you look at the global prevalence of obesity, it's about 2.11 billion, a staggering number, in the adults aged 25 years and above. And if you look at the male and female divide, approximately 1 billion were males out of the 2.11, and 1.11 were females. Dear friends, I must also hasten to add that if you look at the global prevalence of obesity, it is good to remember that we have a bad reputation, one amongst the 8 countries which have more than half of the global obese people. What are the 8 countries? China, next to it our country India, USA, Brazil, Russia, Mexico, Indonesia and Egypt. These 8 countries account for the more than half of the global population living with either overweight or frank obesity. In South Asia, the prevalence of overweight and obesity peaks much higher, 45 to 49 years in the females and 35 to 39 years in the males. This is also shown in the ICMR in-depth data. That means the obesity peaks at much younger age, both in the females and also in the males. And that's a huge problem for the life before them. Now, this is a paper which was published by us in the ICMR in-depth study, number 23, last month, in the IJMR. And this speaks about the problem of obesity in our country. We have a very high prevalence of metabolic obesity in our country. ICMR in-depth 23 is a nationally representative study, about 120,000 people, assessing the prevalence and the health risk of the metabolic obesity subtypes in India. Now, this study, we also showed obesity subtypes. We had metabolically healthy non-obese, metabolically healthy in the sense they don't have any metabolically abnormality, and they are non-obese, the BMI is below 25. Mono stands for metabolically obese, but non-obese from the viewpoint of BMI. BMI less than 25, but at least 2 metabolic abnormalities are present, and you will find about 43% of our population, obese people, were mono. They were non-obese to look at, but they were metabolically obese. The third one was MHO, very small quantity, about less than 2%, who are metabolically healthy obese. Their BMI more than 25, but they did not have any metabolic abnormalities. Look at the fourth group. They are metabolically obese and also obese to look at. That means BMI was more than 25, and there are more than 2 metabolic aberrations. So I would like to bring to the people here that we have the most unhealthy type of obesity in this study. Mono about 44%, MHNO about 26%, and MOO about 23%. The next one is again our data from the ISMR India published as the projections and the data of the metabolic disease prevalence or the NCD map of India. If you look at this, you will find that the abdominal obesity was in a staggering 351 million people. If you look at the overall obesity, you will find it was about 254 million. So dear friends, I want to make a long story short by saying that obesity, abdominal 351, and also overall obesity is very widely prevalent in our country. So diabetic and metabolic NCDs in India are more prevalent than we ever thought before the study was undertaken. Nearly 1/3 of our population have obesity. And obesity and prediabetes were even higher, prevalent higher across the country, where the diabetes was only 11%, pre-diabetes 15%. Overall obesity, including both abdominal and general, was almost close to 24%. Therefore, obesity and pre-diabetes is ruling the roost, and it is not long that the diabetes epidemic will accelerate because of the prevalence of obesity and of course pre-diabetes. Now, we classify obesity in our country into, based on BMI, very simply for the study, 3 types. BMI more than 25 kilogram meter square, constant to diagnose obesity, commonly divided into 3 types. Overweight, when the BMI is between 23 to 24.9. Dr. Anup Mishra gave this concept 23, so 22 to 24.9, we call it overweight. Between 25 to 29.9, class 1 obesity, and more than 30 is the class 2 obesity. Dear friend, this is very important to see here. The other data we have from the other studies like NFH 5 data, National Family Health Survey 5, very important for us. We found that 23% of the women and 1.1% of the men were overweight as per the BMI criteria. But you look at the abdominal obesity, you'll find 40% of the women, and repeat again, 40% of the women and 12% of the men were abdominally obese. The prevalence of abdominal obesity was about 80 centimeter circumference. But what is most important to remember, we found the prevalence of overweight in children under 5 had increased. From 1.9 to double, it became 4% for NFHS 3 to NFHS 5. So very important to observe the obesity also in children. If you look at the projected trends in India and globally, you will find India's projected obesity trend according to the UNICEF World Obesity Atlas is that we will find girls becoming obese at the age of about 8 and the boys becoming obese at the age of about 9. And you find the global overweight and obesity, if you compare between 2020 and 2035, you will find that both in the males and females, you find from 2020 to 2035, the obesity in either sex is increasing almost by geometric progression. It's a great disease. What are the barriers to manage this great number of obesity? Number one, we do not yet recognize obesity as a chronic and relapsing disease. Please remember, it's a chronic and relapsing disease. Even you treat it, weight reduces, but there is a concept that weight regain occurs if you stop the treatment. So obesity is not recognized as a disease. It is very important. My be-all and the end-all of this talk is to impress on you the obesity is a chronic disease, progressive disease, and it produces great health harm. Now we think that the cultural and family influence on the beliefs, attitudes, knowledge, and behavior of individual towards obesity and self-management, we think these are the factors, these are the misbeliefs and misinformations. Now, cost of the treatment, particularly for patients with a low socioeconomic status, may be high. There are a lot of comorbidities and multimorbidities, and the medications are multiple. Now, there are the patient's factor, lack of recognition, misbelief, misinformation, and also cost of treatment and comorbidities and multimorbidities. The physician factors, lack of time during general practice. We therefore need a focused practice, insufficient training and counseling skills in obesity, and lack of formal diagnosis of obesity, because there are multiple parameters, metrics, which has to be taken into diagnose obesity. Now, how Indian people with obesity assess their health and weight, you'll be surprised to know that only 2/3 of people with obesity in our country consider themselves to have obesity or extreme obesity. 20% did not even consider themselves having obesity. But what is most important, only 1 out of 8 persons with obesity consider that their overall health to be poorer than the other. So either way, 20% totally unaware, and 7 out of people do not know that because of the obesity, their health is poor, and it is very important they didn't realize that. Therefore, dear friends, before I finish, I like to bring you the very important facts. Over 2 billion people, adults above 25 years of age, globally are affected by obesity and overweight, with countries like India, China, and USA contributing to over half of the global burden of obesity. In India, more than 100 million people struggle with obesity, with higher prevalence seen amongst women. And in our country, the abdominal obesity, the treasure in the tummy, the visceral obesity, is especially widespread, affecting 40% of the women and 12% of the men. The latest data from the National Family Health Survey. Overweight prevalence in children under 5 has also risen sharply. It was 1.9% in NFHS 3. In 2 years, it has doubled to become 4%, and is a very bad sign if the childhood obesity and obesity among the children. In India, there are various patient factors and physician-related factors, and these are the barriers to meaningful, optimal weight management. Thank you very much for a patient hearing.